Hello, my name is Hilary Garrett. NHS England is delighted to be leading the implementation of the Child Protection Information Sharing Programme. This programme is really important for us to be able to protect our most vulnerable children.
I think this is going to have a really good impact on relationships between social services and thinking about relationships between health organisations such as ourselves in the emergency department and thinking about relationships with social services. At the moment, I find that relationship is a little bit disengaged out of necessity. Social workers have a difficult job that they have to go out and do. It takes time. We also have a difficult job that we have to do, and it takes time. So to sit down together is difficult because it takes us away from the care that we're supposed to be delivering. Having this system will mean that we're sharing information. It will be enlightening each area about the work that we're doing. We're going to be a lot more interested in each other. We are probably going to talk to each other a lot more. We will find some of these barriers completely break down. And I think going forward, we're going to be much more integrated as a unit rather than separate silos working independently.
Meet George. Social services have had concerns about George's mother and her ability to care for him appropriately. Because of these concerns, George has a child protection plan in place to help safeguard his well-being whilst remaining in the care of his mother. They have just moved home, and George is new at school. Whilst at school, George's teacher, Miss Jones, notices that a wound on George's arm has got progressively worse over the course of a week. George tells her he was bitten by a dog, and she's concerned that the bite has become badly infected. So Miss Jones tries to ring home to speak to his mother, but gets no answer. So Miss Jones takes George to hospital to get the bite treated. Because of the Child Protection Information Sharing System, the clerk in reception informs the medical team that George is on a child protection plan. Because George is new at the school, Miss Jones has no idea that George is on a plan. The doctor is happy that the dog bite was accidental, but because of the Child Protection Information Sharing System, he knows that George is on a child protection plan. He's concerned that no treatment has been sought and that the wound has become infected. The doctor rings the social care team from the local authority where George used to live, whilst the nurse dresses the wound. He discovers that the reason George is on a child protection plan is because of neglect. The social care team are very worried about this scenario and recommend that George is not sent home until a social worker arrives. George is collected by a social worker who takes his prescription and takes George home. They're alerted that things at home might be bad and some kind of intervention may be necessary. But what would have happened to George if the Child Protection Information Sharing System was not installed at this hospital? Without the Child Protection Information Sharing System, the medical team would have had no idea that George was on a protection plan. The doctor could have dismissed any fears about why the bite had become infected as a one-off event, or oversight by George's mum. The doctor would have released George and the teacher would have sent him home. Without intervention from the social care team, it's very likely that George would not have completed his course of antibiotics or gone back for a checkup, causing a potentially serious infection to develop. Luckily for George, the social care team provided a valuable intervention at a time when George's mum was obviously unable to cope. The Child Protection Information Sharing System not only provided a radically better clinical outcome, but also allowed for an intervention from the social care team at a crucial time for George and his mum. The information sharing allowed by the Child Protection Information Sharing System not only saved George from a potentially serious medical situation, but alerted the social care team. Without this, George's neglect might have become even more serious.
If you think about A&E attendances, children will come to A&E, for all sorts of reasons, and some could be just routine. So if you don't have this background information, they will be seen and sent home, and no one's none the wiser. You try and teach clinicians to be a bit more curious when they come in, but sometimes it's just routine stuff, so you won't expect them to tweak there is anything concerning. However, some families are quite obvious when you sort of see them in A&E with the presenting complaints or the presenting problem. Straight away, clinicians will have will sort of assess that there could be some underlying concerns and will start asking questions. So if there is a flag there, straight away they don't have to worry so much about it because they know that somebody's will have information about that child. But if there is no flag, they'll have to ask an awful lot of questions, and some parents are probably quite reluctant to tell you. So yes, a definite benefit.